basic technique for priming TPN in the NICU. We have a dedicated room for priming IV fluids. Put on hat and mask. Clean field with bleach or sani cloth. Gather items: IV tubing, Alaris port, filter, sterile gloves, sterile 2x2 and sterile 4x4, blunt needle, cloth diaper, normal saline flush, and medication line. Prepare sterile field. Build field from far to near. Open items, starting with tubing, then gloves, then open all other items on the glove packaging, using that as your sterile field. Accept the flush and open only the top of the sterile 2x2 wrapper and set aside. Open and prime flush. Recap and set aside. Glove dominant hand and place tubing onto your sterile field. Open intralipid syringe. Connect to intralipid tubing. Set on side of sterile field. Using gloved hand, connect Alaris port to Medline. Pop cap of normal saline flush and connect Alaris port. Set on side of sterile field. Clamp hyperal tubing. Spike hyperal bag by stabilizing bag with non-gloved hand. Hold the tubing in the gloved hand. All fluids are connected. Put on other sterile glove. Add blunt needle at the end of the triple port. Connect the filter to the triple port. And tubing to the filter. Connect intralipid tubing to triple port. Connect Medline to triple port. System is complete and closed. Begin priming fluid lines, keeping blunt needle on the sterile 4x4. Prime hyperal. And clamp. Prime lipids. And clamp. Prime Medline. Place sterile end into the open 2x2 package, keeping connection sites sterile. Organize tubing and wrap in glove wrapper and then cloth diaper. Return IV fluids to correct bedside. This is our procedure for connecting the IV fluids to the PICC line. Open sterile 4x4. Clean PICC connection with alcohol. Place on sterile 4x4. Place new IV tubing on sterile field. Open sterile gloves and 2 alcohol pads. Clamp old IV tubing and remove from pump. Place new IV tubing in pump. Start new fluids. Put on sterile gloves. Disconnect old IV tubing from PICC. With alcohol number 1, clean outside of hub and connection. 5 seconds, 12 strokes. With alcohol number 2, clean outside and top of hub, 5 seconds, 12 strokes. Allow alcohol to dry. Attach new fluids. Clean off any fluid around connection with alcohol wipe. Unclamp PICC line. Verify pump settings.